Hello friends, how are you doing? Welcome to my YouTube channel HealthQ, the place where my mission is to motivate you to look at the brighter side of the health. अभी आप में से कितने ही लोगों ने मुझे कमेंट करके ये पूछा था कि मैम जब मेरे बच्चे को मैं खड़ा करती हूँ तब उसके पैर बहुत ज़्यादा शेक करते हैं. Many people also ask that there is a sense of vibration which is felt when a child is sitting with complete weight on the leg or else even while standing. Now, why does this happen and what we can do about this? We are going to discuss in this quick video today. So, make sure to watch this video till the end. So basically, what your child is experiencing is called as ankle clonus, which means there is abnormal, involuntary and rhythmic contraction happening in the ankle muscles. Now, ankle is just one area of the body where you find this clonus. But in general also, in neurological disorders, there are other body regions as well where the level of spasticity is more. At that time, you might experience this sort of clonus. These areas could be ranged from wrist to your foot to your calf and even sometimes to the entire hand. Clonus is a Greek word which stands for violent and confused motions that are involuntary. And specifically and most commonly seen area for this is ankle region. So whenever a foot is moving up and down, at that time the clonus would be very typically visible. Or as clonus take form of continuous shaky movement of ankle up and down. Now, this clonus is typically the sign of spasticity or hyperreflexiveness of the muscle. What do I mean by that? Now, if your child is going through cerebral palsy, I'm pretty sure you understand the meaning of spasticity. Spasticity is nothing but increase in the tension that's present in the muscle. Now, when there is an increased tension in a group of muscle, the reason why this happens is because there is a continuous and over-exaggerated firing of the nerves that's happening from the brain or else from the higher centers, leading to this continuous contraction and relaxation of the muscle. And apart from cerebral palsy, there are few more conditions in which this clonus is also seen. For example, epilepsy, or else fits, stroke, multiple sclerosis, spinal cord injury and hepatic encephalopathy. So these are the range of neurological disorders in which a patient might experience this sort of clonus. Now, what we can do or else what you as a parent can do in order to reduce this clonus or else cure this clonus. Unfortunately, as the spasticity is uncurable, same way the clonus is also uncurable because it's synonymous to spasticity. But that doesn't mean that you cannot deal with this clonus. There are few ways and techniques with which you can minimize this effect of clonus and even sometimes reduce the extent of this clonus so much that it feels that it do not exist in the life of your child. So what can be done for that? So the step number one and the most crucial and important step is the prevention of spasticity. I've always mentioned in my previous videos as well that if your child is a premature baby, make sure to exercise your child as soon as possible. Do not wait for the cerebral palsy signs and symptoms to appear and then start off with exercises. More movement in natural patterns you will give to your baby, more soothing and comforting experiences you create for your baby, more relaxed he would be and more relaxed would be the tone of the muscle, and hence he will not develop spasticity and thus he will eventually not develop clonus. So remember this guys, clonus equivalents to spasticity, which means higher the spasticity, more frequent would be the clonus. Lower the spasticity, low frequency of clonus would be seen. So if you want to reduce the clonus or else the shaking of the leg of your baby, what you need to work on is reducing the level of spasticity. As I said that you need to incorporate early mobilization, early technique, but still if you have a child or a baby who is having the spasticity and is having the symptoms of clonus, there are few things that you can do in order to manage the symptoms or else even reduce or else minimize the symptom. And the first thing that you need to do is application of cold pack or its ice pack application. Make sure before you start exercising for your baby, immerse your child's leg in cold water, chilled cold water. Or else you can even apply ice pack and do ice massage over it. If you apply ice pack or else do ice massage on the calf muscle, over exciting muscle spindles that are present in the calf region, and thus helps in reducing the level of spasticity and also helps in reducing the level of clonus. So make sure daily when your child is starting the exercises, to ensure to give some ice pack application for at least 15 minutes in order to reduce the level and symptoms of spasticity or else clonus. The second thing that you need to do is make sure to do regular stretching of the calf muscles, be it spastic diplegia or be it cerebral palsy. In both the situation, the calf muscles are at higher rate or else at higher risk of developing tightness. And that's why the child walks in the foot drop position, which means the foot is always dropped and child tends to walk on toes. Now, the best way to reduce and prevent the symptom is initial or else early starting of stretching exercises and continuation of stretching exercise. Never stop stretching of calf muscles. The more regular you are in calf muscle stretching, there would be a delay of development of contracture on the calf muscle, and thus also there would be a delay of development of this clonus. So make sure to stretch the calf of your child every single day without fail. Now the third thing, many a times when a child is doing exercise and he is trying to be more active standing, that point of time kids tend to develop some sort of calf pain. Now calf pain basically happens since there is weakness, and second, there is a continuous effort that is putting the muscles under strain. So in order to reduce the strain and in order to relax this muscle, now you need to apply hot fermentation. Now you must be thinking, first I was talking about ice pack and now I am talking about hot fermentation. What I should exactly apply? Well, I will make it simple for you. So ice pack application is basically a daily practice, which means it's good to apply ice pack before starting the exercise. But there would be few days when your child may complain of leg pain or else calf pain. In those days, you can give some hot fermentation in order to reduce the symptoms. If you feel that child is not able to bear that heat, there is one more way that you can use, and that is called as contrast bath, which means take 1 bucket of hot water and 1 bucket of cold water. First, immerse the leg of the child in the hot water, immediately remove and put it in the cold water. Hot, cold, continuously. Don't keep it immersing. Immediately remove and put it in the another one. So this you have to continue for 15 minutes. That will also help in reducing the level of pains in the child. Now, the fourth thing that should be done is regular use of splints. Splints are super important in order to prevent the contracture of the calf muscle and also helps in maintaining the leg in the right position. When the leg is completely touching the floor, there is very less chances of clonus to come. Because remember, clonus only comes when the toe touches the floor. When the foot is completely touching with some weight on the leg, he will never have clonus. Hence, splints are the way in order to prevent and position the leg of the child in the best position. So, you can either go for ankle foot orthosis. You can also go for ankle foot knee orthosis. And even sometimes you can go for ankle, foot, hip, knee orthosis. It totally depends on the independence level of the child and the decision making of your physiotherapist. So make sure that you incorporate splint on a day-to-day basis. Now, apart from this, there's one more thing that you can do, and that is make sure that you do night splinting for your child. So what is night splinting? Night splinting is nothing but maintaining the foot of the child in this position while he is sleeping. How you can do this? Simple. You can keep a hardboard or a 3-4 stack of pillow when a child is sleeping, ensuring the foot of the child is in this neutral position. it should not go this way, but it should be this way. Other than that, what you can also do is, whenever you are giving standing practice or walking practice to your child, make sure to wear weight cuffs. The weight cuffs are easily available in any store, any sports fitness related store. You can buy half kg or 1 kg or even 2 kgs of weight cuffs depending on the age and weight of your child, and wrap it around the ankle. So whenever your child will stand, that extra weight will make sure that the foot is completely touching on the floor, and hence the clonus will not come. I know guys, clonus is something that you have to deal with it, and you can get more creative with it in figuring out ways to minimize this level of clonus. Unfortunately, as I said, there is no known treatment for this clonus, but I still know there are many people who are living with this problem, with its presence coming very negligibly. So I hope these ideas which I have shared with you in today's video would be of help to you. On that note, I'll end this video here. Make sure to like this video, share this video if you feel this video will help to someone, and do not forget to subscribe to this channel and press that bell icon so that you can get notified every single time I upload a new video. And remember, liking will motivate me. I'll feel that something that I did was of your help. So be generous in giving this likes. See you in another video. Thank you.